You're listening to Traxx FM's podcast. If you've enjoyed our content, more podcasts are available on the RTM Click app and website. Let us know what you think. Please email us at traxxfm.rtm@gmail.com. Like and follow us on social media at Traxx FM Official.
Welcome back and hello and hi. This is Health on Traxx. Today we are talking about floods and risk of disease with our esteemed guest, Dr. Ahmad Riadz Mazeli. And we're talking about floods and risk of disease. And just a brief intro on Dr. Ahmad Riadz. He's the public health specialist, a public health specialist with the Disease Control Division under the MOH. Now, of course, you can watch us live on Facebook Live as well. And today, since we are talking about the floods and risk of disease, just a bit of background to that. Malaysia faces monsoon season, in particular November to March. Now, even Met Department has come up with statements stating that they're expecting it to happen all the way till March. And due to that, we are also exposed to the risk of infectious diseases as well as waterborne diseases, mainly due to the flood itself. Hello and welcome to the studio, Doctor. Always glad to have you in the studio once again. How are you today?
Thank you very much. I'm fine. I'm good.
All right.
Salam Malaysia Madani.
All right. And of course, you were here last. We spoke about the heat waves, and today we are talking about the floods. Now, let's start off with, could you perhaps share with us what are waterborne diseases and how does the increasing of flooding enhances these diseases and also their spread?
Okay. When we talk about waterborne diseases, we are talking in this flood situation. When the flood occurs, the floods also wash away the sewerage will be submerged, and also some of the waste disposal that we put on the anywhere, but this will be submerged and then it will get carried away by the flood. So these points of where the bacteria and viruses can spread through the flood water. So when we talk about waterborne diseases, food and waterborne diseases in flood, we are talking about food and waterborne diseases that are contaminated with bacteria, viruses, and parasites. So this is how the flood can increase the risk of getting food and waterborne diseases.
Especially from places that are already isolated, like our sewage, which is meant to properly drain our waste and all of that. So that gets brought on to a place where they can get in touch with the human skin, they can get in touch with your food and also your other systems as well. Now let's talk about what are some of the most common health risks involved with flooding in Malaysia.
Okay, when we talk about flooding, there are a few things that we have to remember about the health risks. One is, as we said before, is the food and waterborne diseases. And then the next one will be the vector-borne diseases, which is the mosquitoes. And then the next one will be drowning. So drowning is one of the things we have to look into when we are talking about flood. And the next one will be the physical injuries, because during the flood, we may have the flood water with the strong currents. It can bring around the debris, sharp things inside the flood water whereby we cannot see under the water, okay? And maybe we can get the risk of electrocuted. And also we can sometimes, because during the flood, even the animals are trying to get shelters, so they may come to
and bite you.
Yes, so you can be careful of this. Maybe the snakes or maybe the elephants come near you. When you talk about the floods,
Even something simple like a monitor lizard or a rat. Even those can cause infectious diseases within yourself itself, right?
They are trying to save themselves from the flood, just as the humans. Yes,
absolutely. And of course, during the floods, I can tell you it is quite scary. And let's talk about you mentioned vector-borne diseases, right? So does flooding increase the risk of gaining vector-borne diseases like malaria or dengue?
Okay, when we talk about the vector-borne diseases in flooding, usually the cases of dengue and malaria is not going to increase during the flood itself, but it is going to increase after the flood, because that's where when the flood will leave a lot of water pooling some here and there with maybe some rubbish over there. So even just small amount of water can give rise to a perfect breeding place for the mosquitoes. So that will occur after the flood. Usually. That's how the vector-borne diseases occurred in the flood season. Yeah.
Yeah, absolutely, because there's a lot of water where it shouldn't be.
Yeah.
So it's going to start being pulled up. And as you know, mosquitoes love water,
Yeah.
right? And there it will be a rise in such cases. Now, Doctor, what we're going to do right now is we're going to be taking a very short break. And once we come back, we're going to be talking about some of the specific diseases associated with floodwaters. We are currently speaking to Dr. Ahmad Riadz Mazeli, who is a public health specialist with the Disease Control Division. We're talking about floods as well as a risk of disease that comes alongside it. If you have any questions regarding this, you can send it to our Facebook page. We will be more than happy to answer it if it is pertinent to the interview today. And don't go anywhere. We're going to be right back. Welcome back. We are speaking about the floods and risk of disease with our guest, Dr. Ahmad Riadz. Doctor, are there specific diseases associated with exposure of floodwaters? Is there something more prominent during these particular times?
Okay, for food and waterborne diseases, we are talking about acute gastroenteritis, where we can get diarrhea, vomiting, nausea, and all sorts of gastrointestinal symptoms. Maybe you're talking also about dysentery, typhoid, cholera, food poisoning. So these are the diseases when we talk about the food and waterborne diseases. However, we still have to remember that when we are talking about the flood, we are talking also about the some people may be displaced and they have to go to the what they call
PPS.
Yeah, PPS, pemindahan sementara, and there. Some maybe there will possibility of a crowded situation in that area. So in that situation, the diseases like respiratory diseases such as influenza or upper respiratory tract infection, or maybe even COVID can spread to the other people. Yeah. Sometimes we talk about close contact to certain diseases. We are talking about maybe chicken pox, maybe conjunctivitis. Yeah. So these are the diseases that we have to keep in mind when we are talking about the flood.
Absolutely. And typhoid, cholera, now those are words we don't hear unless it's the floods, right? Those are some of the more what we call archaic diseases, which
not really.
Yeah.
It's still going on, but only a small amount.
Yeah.
But it's increasing during
especially during the flood seasons. I mean, it's not something that we hear commonly, right?
Okay.
No, absolutely. Typhoid and cholera, because I understand even in other countries, it's quite a concern, especially with typhoid and cholera, especially during the flood seasons. Now, Doctor, what measures can an individual take to protect themselves and their families during flood from health risks that you have already mentioned?
Okay, first of all, prevention is the best way of avoiding getting these diseases. If for no reason, avoid the flood waters and the flood areas, and do not be at a place where you are not supposed to be in the flood. Yeah, because some people think about flood is having what do you call that?
A water park?
Yeah, water park. Yeah. So they are having their fun time and their happy times in the water, but it's quite risky to get this disease. So because when you're contacting this water, you may collect this disease with you, and then you may spread it to your family, and you may start cooking where you don't practice the proper hygiene when you preparing the food. Yeah, so this can spread the diseases. So it's better that try to avoid these places in flood. Don't try to be there, congested the area and spread the disease.
Yeah. Like if there is a flood, if you can, evacuate from that location.
Yeah.
Remove yourself from that location, get somewhere where it is not underwater, even to the PPS. Once you're there, practice safe hygiene. Make sure that when if you're touching food, make sure you have already washed your hands with potable water and the such. What are some of the other ways that we can avoid these waterborne diseases, Doctor?
Okay, since we have talking for the past few minutes, we already know how and we understand how these diseases can spread to the other people. So when we understand how these diseases spread, so we have to we know how to prevent this the spread of diseases. So make sure that what food that you eating is already cooked. Yeah, don't eat uncooked food, especially like uncooked vegetables. Yeah? If you, of course, you have to drink boiled water. If not, then you take bottled water. And if you have, if you see any food that left over for more than 4 hours, you
Don't touch it.
don't touch it. Don't take it. Don't consume it. And if you also you have to trust your senses. You have to smell, you look, and taste it. If it's smells differently or not, if it's unusually smell, taste, or look different, so don't touch it. Yeah, because that is just small things that we can do to avoid the spread of the disease, or we can avoid that we are getting sick.
Absolutely, Doctor. Now, how does contaminated water during flood pose a health risk?
Okay, as we discussed before, the flood water may collect water from the waste, sewage from the ground. So the possibility of food and waterborne disease is present. So if we touch the waters and then we touch and eat the food, so we may get the diseases from the flood water. Or maybe we can spread the diseases while preparing food for others. So my advice is that if you are infected, you may spread the disease to others, and if you're not practicing the personal hygiene after using the toilet. If you get the disease, please get the early treatment as soon as possible.
Yes, absolutely. Okay, Doctor, what we're going to do is we're going to be taking another short break. We are currently speaking about floods as well as the health risk that they bring. We will be right back after this. Welcome back, and you're currently listening to Health on Traxx with me, and joining me in the studio today is Dr. Ahmad Riadz Mazeli, and he's a public health specialist with the Disease Control Division. We're talking about floods and risk of disease. And Doctor, are vaccinations or preventive medications recommended for people in flood-prone areas?
Actually, there are instances when we can give vaccinations and preventive medicine in the for the people in the flood-prone areas. However, now they are now currently meant for the first responders only. Especially for certain people, like vaccination may be useful for the food handlers, but in this situation, the food is prepared quite freshly from the oven, yeah. So we don't need actually to give a typhoid vaccination actually. And secondly, for the prophylaxis like doxycycline, that one we are giving to the first responders, the bomber, the APM, yeah, for those who are involved in rescuing people in the flood prone. Otherwise, the best way of preventing of the disease is avoid the flood water.
Avoiding it, and of course, always make sure that you're staying away from it. Doctor, now just to deviate for a bit now, is there a suggestion from your end, like they should carry certain kind of medications with them if they are caught in the flood water? Now they should have like a bag full of any medications. So that would you suggest anything of that? So like for instance, like charcoal tablets or something like that. Would you say?
Yeah, it can bring, especially. Okay, I divert a bit. For those people who are already having chronic diseases, they have diabetes, they have hypertension. That kind of people, of course, they have to make sure that their medication is always on their side, put in a bag, so that if they are being moved to the temporary shelter, then they have a supply for at least a few days before our Ministry of Health personnel can give take a look and give medication according to the diseases they have. But if you want to bring anything, any tablets like charcoal or whatever that being prescribed by the doctors for the flood situation, no problem. Yes, please, you can bring along with you.
All right, so it's just preventive measures, right?
Yeah.
Okay, all right, Doctor. So it seems that we are now at the end of our interview for today, and as always, it's an absolute pleasure talking to you. But before we end, is there an advice that you would love to give to people in flood-prone areas?
Okay, first and foremost, always be cautious about flood. Get the news from the from the authorities like Meteorology Malaysia, from the Jabatan Peparitan and Saliran, and be cautious about the food and waterborne diseases. Okay? But please practice strict personal hygiene. Yeah, wash your hands with soap. Yeah, before and after preparing food, before and after eating. Yeah, make sure your food is properly cooked. Yeah, boil your water before drinking it, or you can consume the bottled water. Avoid the food which already in contact with flood water. Avoid the food if prepared for more than 4 hours, and get early treatment if symptoms like diarrhea, vomiting, nausea occur. So there's a few points that we can take home for the situation of food and waterborne diseases in flood season.
All right. Thank you so much, Doctor. It's an absolute pleasure having you here. And of course, once the heat wave seasons comes next year, we will be having you here again. You are our go-to specialist on all of those kinds of instances. And with that, a big thank you from Traxx, and we hope you have a good day, and we'll see you again soon.
Thank you very much.
To our listeners, we spoke about the floods and risk of disease. Our guest was Dr. Ahmad Riadz Mazeli, and we spoke about the floods and risk of disease, and we hope that has been more than eye-opening for you. Thanks so much, and we are going to be back in just a few moments, so don't go anywhere. My name is KG. You're currently listening to Traxx.
You're listening to Traxx FM's podcast. If you've enjoyed our content, more podcasts are available on the RTM Click app and website. Let us know what you think. Please email us at traxxfm.rtm@gmail.com. Like and follow us on social media at Traxx FM Official.